Welcome to our discussion on the 3 core services and the 10 essential public health services. What you'll see is that the link for this particular topic takes us to the Center for Disease Control and Prevention website, and there is a nice first part of this website on the public health system that I would encourage you to look at. However, we're going to be focusing on the 10 essential public health services found down here below. And so these 10 essential public health services actually fall into the 3 core areas. The 3 core areas are assessment, policy development, and assurance. And each of these 10 essential public health services helps us to accomplish those 3 core areas. And so if you'll look at the list here, number 1 is to monitor the health status in order to identify and solve community health problems. Number 2 is diagnosing and investigating any health problems or health hazards that come up in the community. And those 2 things together really capture the assessment piece of public health services. The next 3 are to inform, educate, and empower these people in their community about health issues, to mobilize community partnerships and action to identify and solve health problems, and to develop policies and plans that support the individual and community health efforts. So those 3 things together really capture this policy development piece. And policy development, what you'll find is if you create a policy, that really can be the thing that can drive change. And so that's why public health is really focusing so much on policy, and you'll see that woven throughout the P-Core materials. This last area really is about assurance, making sure that what we think is happening really is happening. So enforcing laws, linking people to those health services, assuring competent public health workforce, evaluating the effectiveness, accessibility, and quality of these services. And then finally, something that kind of is pervasive to all the different areas is researching for new insights and innovative solutions to health problems. And so these areas really capture what public health is designed to do. One thing that people notice when they look at this is that there really isn't automatically within the 10 essential public health services, there are not clinic appointments for patients. That's not something that's automatically included. Some public health departments do include that, but it's not one of the 10 essential public health services that you see here. I would encourage you to look at the PowerPoint and or the PDF that goes along with this. It explains much more in depth the different areas for people who may not be familiar with this yet. Some of you may have more or less familiarity in this area, and so I'd encourage you to look further into this